Good morning, Lake Providence Church family and friends. Dr. Linda Plummer Ward here with a brief health ministry update just for you. So good to have you join us today. We just wanted to give you a few health updates and reminders. Now, in many areas of the United States, the pandemic is actually improved. The numbers of cases and the numbers of deaths are both decreasing. We're still seeing a good number, about 70,000 cases a day in the United States, which is high, but it's much better than during our most recent surge. The CDC continues to recommend that all of those unvaccinated be vaccinated. That is still our primary mode of reducing severe illness and death from COVID-19. Now, boosters have been recommended as well and approved by the FDA for emergency use authorization. Pfizer booster is recommended about 6 months after the second dose of the Pfizer vaccine. The Pfizer booster is recommended for those age 65 and over and those age 18 to 64 with high risk or frequent exposure. If you had both doses of the Pfizer vaccine 6 months or more ago, you can take the Pfizer, the Moderna, or the J&J boosters. The Moderna booster also is recommended 6 months after the second injection of the Moderna vaccine. The booster dose is half the vaccine dose for Moderna. Those 65 and over and those 18 to 64 with high risk or frequent exposure should get a booster 6 months after the second shot of Moderna vaccine. If you had the Moderna vaccine initially, you can get the Pfizer, the Moderna, or the J&J booster. The recommendation for the J&J booster now is different. As you know, it is the one-shot vaccine. The J&J booster is recommended 2 months after the J&J vaccine. For everyone who had the J&J vaccine 18 years and older, you need a booster 2 months after the vaccine shot. 2 months. You can take the Pfizer, the Moderna, or the J&J booster. The Moderna vaccine has been shown to maintain its efficacy longer than Pfizer and the J&J. Any of the 3 boosters may be taken regardless to which vaccine you took initially. It's requested that you take your vaccination card with you when you go for your booster. The FDA has also approved vaccinations for COVID-19 for children ages 5 to 11. This is the Pfizer vaccine, and it is 1/3 the adult dose. Flu shots are also available for protection against the flu. But now remember, the flu vaccine provides no protection against COVID-19, and the COVID-19 vaccine provides no protection against the flu. Some people are taking them at the same time without issue. However, I would recommend that you take them a couple of 3 weeks apart. For those of you who were hesitant to get your physicals or checkups during the pandemic, it's a good idea to get that done now. Don't ignore your regular visits. And also, if you develop symptoms in the meantime, don't hesitate to get checked in your doctor's office or an emergency department. Mask and social distancing will still be required. It's important that you take care of your health as usual. You've probably heard about the Pfizer pill for COVID-19. The pill is for people who have been diagnosed with COVID-19. However, it has not been approved by the FDA, so it is not on the market at this time. It's not expected to be available until the end of this year. Now, October was Breast Cancer Month. If it's time for your mammograms, make sure you get that scheduled and done. We also observed Mental Health and Domestic Violence Month. This has been a very stressful, almost 2 years now. If you need help, reach out. Don't try to handle things alone, and don't isolate yourself or allow yourself to be isolated. Help is available. Seek counseling if needed. Also, during the pandemic, there was an increase in domestic violence and child abuse. There are many resources for help. Please get help if you need it. The LPMBC Nashville Health Facebook page is available with lots of information for you, and it's updated regularly. We are also available if needed, and you can reach us through the church office, on the church website at lpmbc.org, and through our Facebook page. As always, stay safe, stay healthy, and stay prayed up. Thank you.